Nurse on Mission Honduras provided a once-in-a-lifetime experience to learn about healthcare and culture in a new country. While we all anticipated that we would be providing medical care to a group of people who are so desperately in need, I don't think that any of us could have imagined how much we would, in turn, learn from the Honduran people. As we looked into the eyes of the Honduran people, it is amazing what we discovered about ourselves. Our interdisciplinary team consisted of our professors, Dr. Mitchell, Dr. and Mrs. Girton, Dr. Manigo, and Dr. Allen, as well as 2 undergraduate nursing students, 4 medical students, 2 undergraduates, 1 nurse practitioner student, and 2 pharmacy students. After packing all of our supplies donated by family and friends, we set off on our journey from Atlanta and flew into San Pedro Sula, Honduras. From there, we traveled by bus to Copan and toured the ancient and historical Mayan ruins. Here, we learned the history of the early indigenous Honduran people. Our next experience was a long, winding, and sometimes terrifying ride to the capital city of Tegucigalpa. On the way, we got to experience some of the beautiful, mountainous scenery that Honduras has to offer. At the same time, we also witnessed poverty that most of the citizens are living in. In Tegus, we met our wonderful partner organization, HOI, who would be so pivotal in ensuring this medical mission was a success. After a brief stay in the city of Juticalpa, we finally made it to the ranch where we would be staying for the next 2 weeks. Although the first 4 days were spent relaxing, going on tours, and shopping, we were all excited to start the clinics and to do the work we set out to do. After hours and hours of counting pills, labeling, counting pills, packing, and more counting pills, we were finally ready.
During our 8 clinic days, we saw several conditions that are very common in the U.S., including headaches, coughs, colds, hypertension, and skin disorders. But we also saw some conditions that were a direct result of the drastic health disparities that exist only in Honduras. One day during clinic at the ranch, a couple ran in carrying a boy that had been hit by a motorcycle and was covered in blood. We sutured his scalp laceration and stabilized the bleeding. The family was sent to the nearest hospital 3 hours away in Juticalpa for a CT scan of his head and evaluation of a possible femur fracture. The patients here are disadvantaged because there are no ambulance services to reach them in an emergency. Currently in the United States, newborns are screened for developmental disorders prior to discharging from the hospital. However, in Honduras, they do not have access to health care to be able to screen their children prior to discharge. Because such resources are not available, many children with developmental disorders are not identified. was a welcome change to see people so appreciative of the work we were doing and so grateful for the help they were receiving. In the United States, people often get aggravated after waiting in air-conditioned waiting rooms for longer than 20 minutes. At the clinics, people would often wait for hours in the sweltering sun to be seen by the provider. During the long wait, they were still so appreciative when they left, adorning us with hugs and thanks. This graciousness and patience is something we will carry with us and something we can all learn from. Our team worked to assist over 750 patients, offering medical care and advice in order to promote quality health care. Personally, we have learned a lot about our strengths. We realize that each day we live, we are offered the opportunity to share the love of Christ with others. We know that God has blessed us with so many gifts, and our goal in life is to share those gifts with others, to use the talents we have in order to guide others. We are appreciative for the Mercy on Mission program providing us this opportunity. We find comfort in knowing we made a difference. As we reflect and look back into the eyes of those we met, we discover so much more about ourselves.
See